So then looking at disease. So rubella is a viral infection, and for the most part, this is prevented by vaccine. So if your friends and family are getting vaccinated, then your risk of rubella and your risk of your baby getting congenital rubella is low. But the main outcome of a baby getting rubella, besides the rash, is deafness. So they're going to have a hearing disability. They may have, they may be smaller and grow at a different rate. They may have eye defects, may have heart conditions, and even intellectual disabilities. HIV is a disease, is a contagious disease. It's an infectious disease, and adults that have it can pass it on to their baby. There is a medication that came out in 1994 that reduces the transfer by 10%, but it's still highly likely that you're going to pass it on. So a reduction by 10% is a significant amount, but we still haven't eliminated the passing it on yet. HIV can be especially detrimental to the baby. So it's hard to live with HIV as an adult, but as a baby, 9% of those, most of them are not going to live to 2 years, and most of those that live past 2 years only live to 13, just because it takes a really hard toll on your body and development, makes you more susceptible to other diseases when your immune system is already weak. So it's not good for the baby. Toxoplasmosis. So the first thing that my doctor did when I went in for my checkup the first time I got pregnant was ask if I had any cats, because changing out the litter in cats is how toxoplasmosis gets transferred. So if you're pregnant and you have cats, then congratulations, you're off the litter box duty for the next 9 months. Okay? And so it seems silly, but it really is important it's an easy way to avoid a disease that's possible for your child. So make sure you check on that. And then RH factor, which is probably something you've heard about before, talked about. It used to be a lot bigger deal than it is now. Thankfully, science and technology has come up with some good solutions for this. But if you look at your blood type, right, you have either A positive, A negative, A B positive, A B negative, O positive, O negative. That plus or minus is whether you have the RH factor or not. And so if you have an RH positive dad that has a child with the RH negative mom, and you get an RH positive child, then the child has an antibody that the mom's blood type doesn't recognize. So her immune system starts to attack the child. And with the first baby, it usually it just takes a long time for the mom to recognize the antibody. And so usually it's not an issue for the first child, and then they'll give you an injection after that child. And so for the second child, your body is prepared for the antibody. So this is something that they'll test early on in pregnancy and they'll be aware of. So just making sure you go to your physicals and follow the doctor's orders for that. For diabetes mellitus, so type 2 is the type that you develop through poor habits. So you're eating too much and your body becomes insulin resistant. And so if you have diabetes mellitus type 2, then your child is likely to have high birth weight, a high chance of obesity, and also high amounts of insulin, which is going to cause insulin resistance. So you're increasing the risk of your child getting diabetes as well. And then there is a diabetes that you get, gestational diabetes, that you develop during pregnancy. And so you want to be careful to not overeat when you're pregnant either. So be careful of those things, be concerned, and take care of your body so that you can take care of your child. So then looking at genetic factors, and these are just a few. Down syndrome is a genetic mutation. So again, remember we talked about a second ago that genetic diseases aren't necessarily inherited. So Down syndrome doesn't mean it's genetic in that it's a mutation. So it doesn't matter whether the mom, the dad, the cousin, sister had it. It's just a mutation that happens during the process of reproduction, and where the chromosome 21 has 3 instead of just 2. And Down syndrome is more common when older women give birth, but that doesn't mean that just because you're older and you're giving birth, you're going to have Down syndrome. It's just a higher risk. And so Down syndrome results in a low IQ. They're going to have delays in motor development, and they have some distinct facial features, right? If you see it, any child with Down syndrome, they look very similar. Cystic fibrosis is also a genetic disorder, and this one is one where it gets passed down. So they'll do a blood test. One of the blood tests that they do in the beginning of your pregnancy will check for your risk for the baby having cystic fibrosis. Half of the children that have cystic fibrosis die before they're 30. Some will even die prematurely, like in infancy. Half of those that live will die before 30. My husband actually has cystic fibrosis, and thankfully he just had his 32nd birthday. And so we believe that God healed him from this. It mostly affects your lung function. So you're going to have a lot of, it's going to increase your risk for any disease that affects your lungs. So breathing, pneumonia, flu, those kinds of things. Asthma as well. And so it keeps you have a lot of medical issues growing up, and then you're at an increased risk of getting disease because you're already fighting off other medical things. For Fragile X syndrome, and this is also a genetic mutation. And so, but it is one that is passed down. So if the mom has the mutation, then it's likely to be passed down to the children. And so Fragile X is linked to autism spectrum disorder. So basically, if you have a Fragile X, then you're increasing the likelihood of having autism spectrum disorder, but they haven't necessarily found a causal link. Those with Fragile X usually have delays in their motor development, so they're going to be a little bit behind. They may have low muscle tone, and they may be extra flexible, so they're going to have what people try to call double jointed type of flexibility.